Hi, today I'll be talking about cubital tunnel syndrome. Cubital tunnel syndrome is a common problem that I see a lot. It could be caused by injury. Sometimes I even see it in young people that lift a lot of weights that compress the nerve at the elbow. And a lot of times I'll see it in patients after having surgery or an injury and they've kept their elbow flexed for a long time. They can often develop numbness at the pinky and ring finger because the ulnar nerve that runs through the elbow has been compressed for any of those reasons. The pathophysiology, again, is compression of the nerve at the elbow, decreasing the ability of the nerve to transmit both motor and sensory signals. On the exam in my office, I often ask them about numbness in the pinky and the ring finger. I'll test their small finger strength to see whether or not it's weak. And imaging is usually negative since it's a soft tissue or nerve, so I normally do not get x-rays for if I suspect this condition. The treatment is usually some kind of anti-inflammatory medication, bracing at night to keep the elbow straight, and therapy for hand stretching. So if you start to notice any of these symptoms, what I normally will tell patients is try to sleep with your elbow straight as much as you can, even before you seek attention from a doctor, and then using over-the-counter anti-inflammatories for 1 to 2 weeks. And then if those symptoms do not resolve, then I would recommend that you come in immediately to see your doctor, because sometimes the doctor will need to order a nerve study to see whether you've developed cubital tunnel syndrome. So I will now demonstrate the cubital tunnel exam. As we said earlier, the cubital tunnel is the tunnel where the ulnar nerve of the elbow runs through. And that nerve goes and gives sensation to the small finger and ring finger. So on exam, what I do is called a tap on the nerve, or Connolly. So if I tap along the nerve and the patient says, ouch, and I ask them, do you feel anything shooting into your pinky and ring finger? If they say yes, that's a positive Connolly. Okay, and then there's an elbow compression test or elbow flexion test. So if I ask, so Adriana, hold both elbows like that. So I ask them to hold it, and if they start to complain of numbness of the small finger and ring finger within 60 seconds, that's also a positive elbow flexion test. And then finally, I will compare their sensation. I'll ask them, do you feel any difference between the pinky on one side or the other? If they say yes, I have more numbness in this finger, that's a sign that they may have cubital tunnel syndrome. And then finally, to test the muscle strength that is innervated by the ulnar nerve, I'll ask them to flex the pinky and resist me. So Adriana, pull. So if Adriana had cubital tunnel syndrome, she would not be able to resist me like that. So patients with cubital tunnel syndrome will have a weak small finger flexion. So that's essentially what I look for on a cubital tunnel exam. If you are feeling any of these symptoms currently and you need to come in to see me, please go online and book your appointment at Peachtree Orthopedics. Thank you.